Good afternoon. My name is Julie Babbage, and I'm the Executive Director of the Diabetes Patient Advocacy Coalition. On behalf of DPAC, welcome to the New Jersey Diabetes Advocacy Forum. We've hosted this series in several states so far, and New Jersey is our fourth state. So we're really excited to come to the Garden State because there's a lot happening this year, and really every year. New Jersey is very active on health issues where diabetes advocates can be involved and heard on important policy decisions. So we've got an audience here and on Facebook Live, and that's representing folks across the diabetes community. Based on the registration, we know we have a fairly even spread between type 1 and type 2, friends, family, and parents of children of people with diabetes. So thank you all for joining us. So let's switch gears now. Before we get into our first panel, we want to ground ourselves just in the context of where we are and what New Jersey as a state looks like when it comes to diabetes. So just briefly, 1 in 11 people have diagnosed diabetes in New Jersey, which is just over 9% of the population, and another 3% are undiagnosed. On this side, you're seeing prevalence by county. Diabetes is most common among people who are 65 and older, and so this map is specifically showing the Medicare population, but it helps to contextualize the numbers and even the inequities by region, since it closely mirrors the rest of the population. Prevalence is highest in the southern counties of Cumberland and Salem, which are both at 12.4%. And remember, the average is just above 9. So that is significant. On the next slide, you're going to see that New Jersey has a higher prevalence than the country's average for prevalence, and hospitalization rates are just right about on par with the country average. We always point to the expense of diabetes because when you're talking about Medicare or Medicaid, the government shoulders a lot of this cost. And so it makes good economic sense as well as just good plain sense to cover diabetes so that it can be managed well instead of getting to more expensive emergency room visits and life-altering complications. So now that we've got some context on what diabetes looks like in New Jersey, let's transition to our first panel for the legislative perspective. I'm going to introduce our moderator while our panelists and moderator turn on their cameras so that we can have them join us on screen. Ed Hawthorne is the vice chair of DPAC's affiliate organization, the Diabetes Leadership Council. He is a former chair of the board of the American Diabetes Association and has served on several other boards, including the Red Cross and the March of Dimes. He is currently the chief COO and managing director partner of CE3 Solutions. And Ed is really a champion for people with diabetes for decades. He is actively involved also in the state of California, where he resides with his family. Thank you, Ed, for joining us, and I will turn it over to you to introduce our panelists.
All right, well, thank you, Julie. And we are honored and so grateful to have with us 2 individuals from the state legislature who are moving the needle towards better laws that help protect patients. Now, we'll get to that and the issues that they're working on, but first, let me introduce them to you formally. Assemblymember Herb Conway represents New Jersey's 7th legislative district. Notable among his committee assignments is his role as chair of the Health Committee. Elected to the legislature in 1998, he is the only member with both a medical and law degree and holds a bachelor's from Princeton University. Dr. Conway specializes in internal medicine and serves as director of Burlington County Health Department, where he has been recognized for his leadership as one of New Jersey's most successful vaccination sites. Dr. Conway also served as a United States Air Force captain at McGuire Air Force Base as a general medical officer and assistant director for the clinic at the base. And next, Assemblymember Dan Benson first joined the Assembly in 2011. And is currently serving his 4th term representing New Jersey's 14th legislative district. The Assemblyman currently serves as the chair of the Transportation and Independent Authorities Committee and as a member of the Health and Budget Committees. In addition to being deputy conference leader, he too has an impressive educational background. With a bachelor's from Georgetown University and a master's of public policy from Rutgers, was recently recognized by the State Access to Innovative Medicine Coalition as their 2020 Legislator of the Year for his bill, which capped out-of-pocket medical costs. So thank you both for joining us today.
Thank you so much.
Great. So I'll start with a question. So everyone has a connection to diabetes. So tell us yours and why you work on this issue. For instance, I know Dr. Conway, you encounter diabetes in your work as a physician. I'm not sure if Dr. Conway has joined us. So Assembly Member Benson, can you tell us about your connection with diabetes and the work that you do?
No, absolutely. So in addition to obviously representing numerous constituents that face medical access issues or live and thrive with diabetes, my mother is someone who I care for. She has type 2 diabetes, as well as other complicating ailments. And so managing her health is really key, and we work on that together. And same thing, I have other family members with type 2 diabetes. And as often is the case, it's not just one thing. Most folks of a certain age, or even those of my age, it's not just one thing. It's not just diabetes. There's usually something else going on as well. Now, also personally, I serve on a federally qualified health center board in the city of Trenton, which is the Henry J. Austin Health Center. And so we look at this issue of population health and how do we manage diabetes rates, and looking at the success of making sure care is given to keep those costs down, emergency visits down, and broader health outcomes to make sure those are successful. And so that's been my kind of introduction to the world of diabetes, and working with advocates in my district to better understand what are the barriers they face to getting care.
Great. Well, thank you so much. And Assembly Member Conway, are you connected?
I believe so. We had I often do this in my home office, and so I'm here in my ledge office, and I'm having difficulties getting connected. I don't know if I'm or not. I have to use my phone. I don't know. I apologize, but this is more for a workplace for my staff than it is for me.
Oh, that's okay. Well, welcome to the world of Zoom. So
yes, I don't know if I can be seen or not. I can't see. Usually, I can see myself to see if I've even squared up on this phone. But,
well, we can't see you yet.
Oh, okay. Let's see. Let me figure out what to do here. Usually, it will ask me what about my camera or. Microphone's unmuted. Oh, okay. Well, I'm pushing the start video. Well, at least you can hear me.
Well, let me. I'll just continue on with a question for you. And we were just having a conversation with Assemblymember Benson around the connection to diabetes and why you work on these issues. And as from your profession, you come in contact with a lot of diabetes in your work as a physician.
Yes, that's right. And I sort of firsthand knowledge as a physician, certainly not firsthand as a patient, but as a physician, certainly it is a very common diagnosis. And we do, and working at St. Francis where I'm on staff, we do see a lot of people who are underinsured or uninsured, and that always presents a challenge with respect to getting the optimum treatment for their situation. And then even those who are insured, we have seen that there are difficulties navigating insurance to get what they need for their particular situation. So it's one of the reasons why things like the step therapy bill are so important, because we have seen that there are insurance barriers to care and getting particular medications that I believe are unwarranted challenges to the care, the optimal care that people naturally want to seek for themselves and for their families. So this bill really sort of sets the rules of the road so that insurance companies have to respond appropriately to the prescriptions that are written by the caregivers of patients, physicians, and others who are writing prescriptions according to a plan of care, and that if these certain medications are going to be denied, there needs to be a basis for that denial that's not just driven by financial considerations. And I recognize insurance companies have those, but over the years, it seems to me, and it certainly seems to many patients and to many of my fellow physicians, that these rules have less to do about optimizing care for patients than they do about other considerations that don't inure to optimal care for patients. So we want to remove those barriers, set the rules of the road, make sure that people can get the medicines they need, so they can live, as long a healthy life as they're able to live.
That is some awesome work that people with diabetes definitely need. So I appreciate all the work that you're doing. And Assemblyman Benson, so how about you? I know that, can you speak to A954, the copay cap bill, and why this legislation is important?
Sure. A954 provides that if the purchase of insulin is would not be subject to a deductible, and requires health insurers to limit copays and coinsurance for insulin. What we've been finding is that health insurers on certain markets are really just making folks, particularly if they have a high deductible, really putting insulin out of reach for those patients. And so the bill requires health insurers and health benefit plans to provide coverage for the purchase of insulin that's not subject to a deductible, and to limit that to $50 per 30-day of insulin. And this is sponsored, has already moved in the Senate, and it's sponsored by my colleagues that are on the Health Committee and in the legislature. And I know our hope is to see it moved on our side. And this kind of works on work that I've done in the past on more broadly for all medications, looking to make sure that insurers offer plans that do cap that out-of-pocket cost. Because we know once the price gets above a certain level, people either start rationing their medications, or they opt not to take their medication. Even if after the deductible is met, they would then actually pay a similar copay over the life of their insurance. But if that first dose is too expensive, we know folks do not seek care. And so we want to make sure, by making sure that these things are capped and not subject to deductible, we can expand access for folks that have insurance. And our feeling is, if you have insurance, you should be able to use your insurance in a way to keep you healthy, not as a barrier to health.
Yeah, so you're both working on different bills. I guess I have a sort of a question that says, how do these two bills work together, or how do you work together? It's sort of like there's strength in numbers when it relates to the fight for better access to care for people with diabetes, and you're both working on it from different angles. Do they come together? Do they connect in some way? From your perspective, I'll throw that out to both of you.
Well, there are, healthcare is a complicated system, and there are many aspects of it, and legislation is not usually not comprehensive in any particular space. And it's one of the issues with healthcare delivery in our country, is the complicated nature of it. It's difficult for people to navigate. There are a lot of rules that are require a lot of work on the part of patients and the people who provide healthcare to master, so that they can deliver care to patients. And so when you look to tackle a problem, or there's a problem of access to insurance, a problem of access to medications, even if you have insurance. If you look to all of the supply chain of pharmaceuticals, for instance, decisions that are made about utilization, hospital care. I mean, there's just a lot of space. There's the outpatient system. There's the after hospital care system. So there are a number of pieces of legislation which will deal with parts of that, in part because these are challenges or obstacles that are alerted, or that are sent to us as issues, and then we work on that specific issue. It is for think tanks, I guess, to look at things comprehensively and then bring those suggestions to the legislature. We can do larger bills. For example, dealing with mental health parity would be an example of a larger bill that expands, really half of the care that people need, or maybe more of the care that people need in mental health. And you realize over the years that people weren't getting mental health care, and we're seeing the purchase of that today is that we have a pandemic that's causing unbearable stress for a lot of people, and we don't have a as well developed a mental health care system as we ought to have, because for a lot of reasons, mostly because it's been neglected over the years. There hasn't been enough attention paid to it. It's been shrouded in stigma across all levels of our society, and so there has not been how shall I put it? We've not been able to move mental health to the forefront in the past, as I believe is happening today. I think people people who have come forward to talk about their life experience, I think more people are understanding the impacts of mental health on their family members, and they're certainly seeing it now in the setting of a pandemic where they might not have seen it outside of a pandemic. And so as public attention is being raised to this, and thank goodness, it will move the legislature to address the various aspects of the mental health system that need addressing, and there are plenty of needs, and there's plenty to do there for sure.
Yeah, and what I'd like to do is add, and I think Chairman Conway really hit the nail on the head. Healthcare is a very complex issue. There are different aspects. Obviously you have the patient, which we try to keep center focused, but you have the pharmaceutical manufacturer, the pharmacy, you have third-party managers, you have the insurance companies, and you have government oversight. We try to look at it from issues of access, affordability, and accountability for each of those different actors. And I give a lot of credit to Chairman Conway. There are thousands of bills, over 5,000 bills in the assembly side. Hundreds of those may be dealing with healthcare. And so how do these interact? It's because the leadership of Chairman Conway, he looks at all those health bills and then says, okay, these are ones with diabetes that may affect. And so at this next hearing, we may try to put together a bill about healthcare access or accountability for the insurance companies, or about affordability. And so, with step therapy, when we look at making sure pharmacies provide information on pharmaceutical assistance programs from the manufacturers, while also putting accountability issues on how step therapy is applied. Chairman Conway is the man who sits down, goes through all those bills and say, yes, we can put these pieces together to make a whole, and try to move that through our House, working with the Speaker and members on the committee like myself. And that's really how it all kind of comes together. And that's where the advocates come in to provide their backstories and their personal stories on why each of these pieces of legislation are both individually important, but even more so as a whole.
And we do recognize the complexity of it, and I'm sure that you both understand from a person with diabetes sort of what that means for them. And so we think about sort of diabetes like this big old ecosystem, right? There's lots of people wanting to do lots of things, just as I'm sure you see. And so one of the things that DPAC tries to do is to get that voice together collectively, because if we can sort of focus on the priorities for you, it seems like you're better positioned to help us. So we appreciate all the work that you're both doing.
Absolutely.
I have another question here, and from a member of our audience, Kenny, and it's related. His question is, are there any plans in New Jersey to improve the Medicaid coverage of medication, supplies, technologies, and other therapies needed to manage diabetes?
Well, I know there's one barrier that is, would have liked to have seen kind of this more on a federal level, although it's impacting us. As I mentioned earlier, I sit on a board of a fairly qualified health center. And what we're seeing is, we get a lot of our medications through what's called the federal 340B program.
I can be seen, but I can't
and
be
what
heard.
we're seeing, we can see Chairman Conway. That's good. And so we're seeing a lot of manufacturers, pharmaceutical manufacturers, pulling back on those discounts. And so that was an easy way for a lot of federally qualified health centers to get those medications out to at-risk populations and really focus on population health. So I think there's a lot of issues on the Medicaid side, both in access and in maintaining those relationships, particularly during the pandemic, which has made that more complex. And I know Chairman Conway, I'm sure, can add more based on what he's seeing both in the field and at the county health level.
Yes, I would agree with everything that my colleague has stated, and has been very kind in his assessment of my work as the chair of this committee over many years. But it is, advocates are very important to the process. And, I have to say I'm struggling a little bit because my Zoom was updating, if I see me on the screen, and so I didn't catch the whole question. So could you just repeat the question for me, please?
Yeah, absolutely. It was from one of our audience members, Kenny, and he was asking if there are plans for New Jersey to improve the Medicaid coverage of medications, supplies, technology, and other therapies needed to manage diabetes.
Well, we've looked at that issue, parts of that issue over the years, and making sure that people have access to certainly to something as basic as a glucometer to make sure that people can manage their diabetes along with their healthcare provider. But we're seeing that there are additional technologies coming online that that improve the monitoring of diabetes, and we want to make sure that those advanced monitoring equipment is made available to the Medicaid population, because we'll get better outcomes. And we're trying to create a system that's fair to everybody, irrespective of your income. And that means that as new technologies come on and they're proven, where you can monitor your blood pressure without doing a finger stick, where you get continuous monitoring if you need it, that those devices need to be made available to everyone who would need them. And so we need to make sure that our Medicaid program is keeping up with what we're seeing in either the Medicare space or in the commercial space.
Great. Thank you so much.
So what will be important for us in the legislature, as legislators, is to hear from people. Are we having difficulty getting the equipment that they need? Is Medicare turning down coverage for the latest monitoring equipment, where you can, again, you wear it for a week, it monitors what you need to do, your sugar, so that you make adjustments to your medications and as needed, bring in a very nice history of what your sugars have been over the course of time and over the various days, and often, if it's really done well, or according to what you've eaten, so that your medicines can be adjusted to achieve the right numbers and to achieve better health. We want to make sure everybody has that. So those who are listening, if you're having problems getting a hold of or having coverage for these newer devices that are coming online now, that are increasingly becoming available to the population, you need to let us know, and we'll get after it.
Great. Well, thank you so much. And now Dr. Conway is chair of the Health and Senior Services Committee. I can imagine how busy you and your colleagues have been working on issues related to the pandemic. And it's been well reported that COVID has had a disproportionate impact on a segment of our population, and we generally call this health inequity. And so how are leaders working to address this for people with diabetes?
In fact, they just left a vaccination clinic, a pop-up vaccination clinic held at a local African-American church. And like so much what happens in public health, it's a team effort. So you have the state government that provided an allocation to our partner hospital, Virtual Health, who then put himself, or the organization put themselves in contact with 2 churches in an area, recognizing as we do the disparity in acquiring vaccination that we see often, the result of a digital divide. I mean, in order to get these vaccinations, and to achieve that, I won't say easily because it's been difficult for everyone, but if you have a computer in your home, if you have a computer in your desk at work, if you have, time, if your work life allows you to have time to get online, and you know how to refresh your computer and be persistent and struggle to get your appointment, you can get an appointment. If you are working in a retail setting, if you're working on the factory floor, if you're working in a warehouse, you're not working with a computer on your desk, and you may not have a computer at home. And if you're elderly, a lot of older people are not going to have a smartphone in their hand. They might have a cell phone, but they might have a smartphone. And if they do, they might not know how to use it well enough to be able to access an appointment system that is by and large online. And so here in the county where I'm a director of county health, I follow these numbers. I can see we're doing very well. Actually, we're doing very well among the senior population, which I'm very proud to say. But we know that, but we're not doing as well among the African American, the Asian, and the Latinx population. And the effort today at the church helps us get after that. And so we're going to be seeking partnerships with other churches, other institutions across the spectrum to make sure that we address the disparity, and indeed take the digital landscape out of the picture by going door to door, getting volunteers on the street, getting to households and say, would you like a vaccination? Here, let's sign you up. We'll be back to you with an appointment time for you to come. Either we'll come to the neighborhood, have transportation, we'll bring you to a perhaps more efficient way, usually drive through or others, where we can bring you to a center, a central location, and bring you through and get yourself vaccinated. It's critical. We want equity across this process.
Yeah, I was going to say that's really been the laser focus for most legislative members, is how do we make this a more equitable process, and particularly for the senior population. When things expanded out more broadly, we saw, because the demand exceeded supply, there really was a lot of have and have nots based on whether you had a computer or not, it was mentioned, or what your proficiency level was with that computer. And so, after a lot of kind of advocacy from members of the legislature and from the public, the administration, and we've seen now there is a dedicated hotline just for seniors, something that's been suggested many times. And I'm happy to see that, because not only can they help you with registering, which is what the original hotline did, this is actually making appointments. And with the J&J vaccine, this now is a game changer, as we hopefully will get more of those in late April and into June, to allow us to do that door to door without having to worry about the storage, and really focus on homebound and other folks that are unlikely to get a second dose. Folks that may be in a homeless shelter, or those that are more transient. You want to be able to target that population with a single dose and then not have to worry whether they follow up or not.
Now, I know that one thing I think, Dr. Conway, that you mentioned was that you're doing pretty well with seniors. You're pretty proud about that, but not as well with African American, Asian, other community. Is that an issue that is age driven as well? So,
well, it may be. We've done a survey in our county, and maybe others too, to identify areas where there are higher concentrations of people of color, and so that we can then target our door-to-door efforts to reach those who are not able to afford the digital divide now. Of course, everything depends on getting vaccine, and so we're planning and preparing for this markedly increased allocations of vaccine than we're currently getting. The president so far, when he's made a promise to the people on this COVID for the pandemic, he's met all of those promises with action. And so if he tells us be ready in April and May, because there's going to be plenty of vaccine available, we need to be ready with vaccinators in place, with appointments that are available, and for volunteers and others to basically go out into the field and bring people into the system of vaccination. I told people today, that vaccines, thank goodness, are safe. They're tested across all races, and there's no report of anyone dying from a vaccine. But there's 500,000 people in our country, more than that, unfortunately, that have died from COVID. And so, as people though are having experiences and interactions with people who are vaccinated, and they hear, that it was, maybe there was a little discomfort, but a little discomfort buys a whole heck of a lot of peace of mind. It will save your life. It will prevent you from dying from COVID by and large, and it will save your family member from dying of COVID by and large, and the community at large. And so, the vaccines are safe. We got to get people vaccinated, and we have to make sure at the end of the day that we're doing whatever it takes to reach everyone, because we can't have, unless we're all in this together, we're not going to really return to normal. We can't have large swaths of the population that are unvaccinated, because if we do, we're going to be living with restrictions, public health restrictions, needed public health restrictions to keep people from dying needlessly of this of COVID-19.
Great, thank you. And Assemblyman Benson, you have anything to add to that?
Yeah, no, I would just add, I think that hesitancy, as Chairman Conway mentioned, as people kind of interact, that's going down. But there's a historic hesitancy for vaccines and other programs that we have to break down some of the misconceptions. We know there's just a broad general vaccine hesitancy among very certain cohorts. And so we fully expect there's going to be a kind of a cross point where maybe as soon as May, but definitely by after June, where we'll have more supply than demand. And so we're going to really have to kick into high gear, both on the education and the outreach. And I can't underemphasize how important it will be to have community leaders stand up to say, this is safe, and we encourage you to do this, not only for yourself, but for the broader community, so that life can return to normal.
Well, thank you so much. And we want to be respectful of your time. And I have one more question for both of you. And that's really around, asking about the best ways that a smart advocate can help you, work with you, and engage their representatives. And often we hear that just a couple of people writing letters to their lawmakers can get some attention.
Well, Dan, you want to start off?
Yeah, sure. I've got my top 5 list that I usually talk about. One, emails are often best. Make sure you include what the name and number of the legislation you're asking to support. Ask folks to co-sponsor the legislation as well. This way you can make sure that your legislator, and try as best you can to write to your own legislator first before going outside your district. We particularly take more interest in the ones that are coming from our own constituents. Make sure the emails and materials are brief, but if there's a personal story, please add that story. Your personal stories are what really makes this work. Find out if that person is sponsoring it that you're writing to. I often get lobbied to support my own bills from advocates. It happens all the time. So before you send that email, look to see who the sponsors of the bill are. And if they are already a sponsor, you still want to contact them, but you want to be able to say thank you. Be respectful of the districts, arrange for advocates to contact their own legislators, and it's okay to set up a time. Sometimes you're not going to get a legislator, you might get their staff. That's often even better because the staffer is going to be the one that's helping to recommend to the legislator which bills are the ones that they should be supporting. And again, like I said, showing appreciation goes really a long way to building those relationships and making sure that you introduce yourself when you see them out in the community, obviously masked during this pandemic, but making sure that you're visible and you're sharing your own personal story. I think those are keys to an effective advocate.
I would agree, and I would take opportunities if you're able, more difficult obviously during a pandemic, to have to reach in and be able to make your case personally face to face. Now, time is limited, and so you might be meeting with staff, but the staff that we're fortunate to have help us, play a very important function, and managing the flow of information to us, so that we can make some judgments about. There's a sort of a hierarchy of needs. There's stuff that we have to do that's very urgent. Pandemic, that was it's been the top of the list for some time. Less so now because a lot of things have been laid into place. But there is a hierarchy of needs that will come through. The more you can put names and faces behind an issue, like everything else, that there's that emotional. It's not only the mind that work, but there's also the heart at work in a lot of what human beings do. And so, having someone who can tell their story, as my colleague has mentioned, is very important to that. We get a lot of information. Brevity is certainly key for a lot of things, and then we can go in with information behind it. So I'm a big one on, let's get an executive summary, give me the big points, and then as I need to go in further, I can do that when I have more time. And so, but those contacts, personal contacts, are important. Bringing people with you, also important. It's not that you can't go it alone, but when you have larger groups, whether it be a religious group or the ARP or a labor union or people organized against drug abuse or whatever the situation is, for housing, whatever it is, those bringing people with you is a way to push things forward as well, because the larger the group is, the more contact there's likely to be among a broader number of legislators who can then say, yes, I've heard about this issue, something ought to be done, who's leading it, how can I help, what input can I provide to you, have you thought about this? And that's how legislation starts to make its way through the legislature, and then hopefully onto the governor's office if we all agree. So it doesn't work without participation. This is participatory democracy that we have. It works best. It's collective wisdom that will lead us onto the right path and down the right path.
Well, we really do appreciate the feedback, and that's really encouraging, especially for our DPAC volunteers. It keeps us engaged and motivated to keep doing what we can do to help you, to help all of us. I'm going to ask Julie if there are any questions before I close out.
No, I think you covered everything. Thank you guys so much, both of you, for joining us. I'm so sorry, Chair Conway, for your troubles on technology, but thanks so much for figuring it out. And we're so glad we get to see you. And thank you, Assemblymember Benson. We so appreciate both of you and your time today. Thank you.
Thank you, guys, everyone. Thanks, everyone.
All right, I'm about to hand it back over to Julie, but I also want to thank you all, not for what you're doing each and every day to promote access and affordability, but more importantly, for the difference that you make in the lives of all people living with diabetes. So thank you so much. And Julie, back to you.
Thank you. Thanks, Ed. Yes, this is very, very important to note. And we know how busy both of you are, and how special it is that you would take time to talk to those in your state who are really interested in being able to work with you on these important issues. So thank you again. We'll let our presentation come back up here in just a moment so that we can talk more specifically about the nuts and bolts of the New Jersey legislature and what that looks like. So we just heard from two members of the legislature, specifically of the Assembly. New Jersey is one of 38 states with what's known as a state government trifecta. So that is that the executive branch, the Assembly, and the Senate are all the same party. And in this case, that's Democrat. Now, if you don't know who your Assembly member or senator is, you can look both of them up using the link at the bottom. And if you want to contact your member or even Assembly Member Conway and Benson, you can find their contact information there as well. You know, one thing we always encourage is a thank you note just to both of those members for taking the time to talk to us today. Also on this page is a view of the dynamics in both chambers. Democrats, as you can see, have strong majorities in both the Assembly and the Senate. However, they don't have what's known as a veto-proof supermajority because they aren't quite 2/3 of the majority. So if Governor Phil Murphy vetoes legislation, Democrats would need Republicans to join in to help override that veto. In New Jersey, the legislature meets throughout the year, which means that they can pass bills most of the year. So in many states, the legislature only meets maybe for a few months at the start of the year. And that means that New Jersey legislators are essentially full-time lawmakers. The Assembly members are up for re-election every 2 years, and senators are a little more interesting. They're elected in years that end in 1, 3, and 7. So their terms are 2 years, 4 years, and 4 years. And that schedule is to account for changes that take place in the census every decade. So 2021, this year, is a big year for New Jersey because it's an election year for the governor, the Senate, and the Assembly. And because Democrats have a major advantage in terms of number, there is sometimes broad agreement among the issues, but that does not mean always. And a lot of times, you know, we like to think that there's always fighting going on in the legislature or in Congress for that matter. And a lot of what people don't see is that there can be broad and widespread agreement on a lot of issues. For instance, the copay cap bill that Assemblymember Benson was talking about actually passed the Senate unanimously. So that's really exciting when that happens. Some bills, though, do need members of both parties to push them through. And these dynamics are just important in understanding you know, how the legislature works, even the odds of a bill passing. If a bill is sponsored by a Republican, for instance, it's going to need some Democratic support so that because you need a majority of the members to vote for something for it to pass. So that's a little bit more about the state legislature. And we'll switch gears briefly into Congress because DPAC focuses a lot on federal issues as well. And so because, of course, today's focus is really on the state, I won't spend too much time here, but we do want to briefly show your congressional delegation. And you'll see here both senators from New Jersey, just like every state has 2 senators. And these individuals serve 6-year terms. Also, New Jersey has 12 members in the House of Representatives. 2 of them are Republicans, and the other 10, as you can see, are Democrats. And these members are reelected every 2 years. I'm going to just go through our next steps here. Sign up on the website. Here is our social media one more time. Be sure you're following us. Please spread the word and recruit people. Just like George says, more voices really helps us to break through all the other noise and issues that lawmakers are hearing about to make sure that they're taking action on what's important to us. Of course, tell your story, as we mentioned. And yes, please go to our website. We'll be sending a follow-up email so that you can click the link to go straight through to the step therapy bill that's currently under consideration in the New Jersey State Legislature. So thank you so much for joining us today on Zoom and on Facebook. We hope that you learned a lot, and we will follow up with you with more materials and links and more action now and in the future to take in New Jersey. Thank you so much.